Hey everyone, today we're going to be talking about capnography. So a lot of people have some questions about capnography, about waveforms, what the right numbers are, what exactly is it. So we're going to talk about a little bit about nasal capnography, ET capnography, and how we utilize them. So first off, normal numbers. So 35 to 45 is a normal range for capno. If it's higher or lower, it can be a lot of different things. So low capnography could be cardiac arrest. So if you have a person that is, in arrest or doing CPR, it should be about 10 to 15 is what we're looking for good CPR. If we get ROSC, of course, we're gonna get a nice spike. So as soon as you see a spike in capno, that's gonna be a sign that you got ROSC. If you have someone that's in the, we'll say 20s, that has a risk of sepsis, that's another indication of sepsis at a low end tidal. Also, blood pressure. If your blood pressure drops or as a trauma patient, that's like a shock kind of thing, your end tidal is going to be low also. So those are a few things for end tidal, for low end tidals. For high end tidals, also low is if they're breathing too fast, they're breathing off all that CO2, and that's going to be lower your end tidal also. High end tidals is acidosis. So that's people that aren't breathing that much. So they're retaining, so your asthmatics, you're retaining CO2, can't get that CO2 out. That's when you're gonna have that high end tidal. Also, if they're not breathing enough. So if you're breathing really slowly, so you have your overdose patients, right? They're gonna be really slow respirations. That's gonna build that CO in their body, so it's not be able to expel it. So that's also a reason for high end tidal. So let's look at the waveforms here. And just do mine today and see what it looks like. So I explain exactly what you're seeing. So all you gotta do is take your little orange thing, screw it in here, give it a twist, and do this before you put it on the patient. If you don't do that before you put it on the patient, it will mess up zeroing out. So always make sure you plug it in, then put it onto the patient. Of course, I messed this up a little bit, but it's all right. It's fine. All right. So first, you're gonna plug in here. Okay. Now, we're gonna put on our patient, which is me today. So cool thing about these, so depending on what style nasal capno you have, so you can apply oxygen to them. But typically, most are blow-by oxygen. So this one isn't. This one goes into prongs, but a lot of times it's have little dots at the top of your prongs here, right here, and that's like blow-by oxygen. So you don't want to put on more than 4 liters per minute because it will wash out your capno. Isn't it a cool, stylish thing? I know, right? All right, so we're gonna see what my respirations are right now. So as you see on the monitor, right now my respirations are, it says 22, and my end tidal is 45. So normal is 35 to 45. Now we're gonna do a test, okay? So I'm gonna hold my breath and let's see what it does. As you see, flat lines, right? Does nothing. Why? Because it's measuring the carbon dioxide. So as you breathe out, you get a spike. This is the most accurate way to a real-time thing we have. Better than blood pressure, better than anything else, is capno tells you real-time what's going on. So when you breathe out, that's giving your carbon dioxide levels. As you breathe in, it makes it go down. If you breathe out, that's expelling the CO2, and that makes it go up. So when you're looking at it, that's where you're looking at. So as it goes up, that's me breathing out the carbon dioxide, and then it'll like plateau, and then it'll go down when I breathe back in. Now, what's some of the waveforms we're looking for? So one is shark fin. So shark fin's an important thing, differentiating COPD versus CHF. So we have a COPD patient we are looking for wheezing, and we're looking for shark fin. Sometimes you have diminished lung sounds with COPD patients, and you can't really hear very good. So in those circumstances, waveform is very important. Nasal capno, very important for your breathing problem patients, and determining the waveform to make sure you get the correct diagnosis. Give them a neb treatment if they have shark fin, and confirm that it is in fact COPD. If you give a neb treatment and all of a sudden that patient now is flashing or like have fluid in their lungs that you hear now, and it changes from a shark fin pattern to a plateau, all right, we're probably looking at a CHF patient. So we might have to change your algorithms. Of course, CHF is going to be the opposite. So we're looking at, it's going to be plateaus. They're listening for that fluid in the lungs, high blood pressure. You're looking for history of CHF and the important questions. So especially CHF patients, important questions I always ask them. 1, have you been on CPAP before? 2, have you ever been intubated before? If so, how many times? 3, is your breathing feeling tired right now? So, sorry. Is your breathing tired right now? So if you're, like if you're, and they look like you're getting tired, ask them, are you feeling tired? Do you need some help? And that's my key words to figure out if they need CPAP. So make sure that they're breathing good, ask them those important questions, the intubation question, CPAP question, and are you feeling tired? And the tired ones, the main thing I'm looking for to determine if I'm putting on CPAP or not. When it goes to end tidal, I think that about covers it for the important things. The shark fin, we're looking for normal plateaus. Of course, there's a ton of other waveforms out there, but those are the main ones we're looking for. We can also change this to end tidal. If we're bagging a patient, of course, we're going to put an ET2 version of ET capno, or if they're intubated, same thing. But nasal capno, very useful in so many situations. So don't forget to use nasal capno. It is a great diagnostic tool to get real life images of what's going on in your patient. So that's about what we're talking about today. I hope you all learned about something about nasal capno, and I'll see you next time.